Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Okay, I read. Go. Left turn. March. Forward. March.
Good morning. Please be seated. Bonjour. Buenos días. Goedemorgen. I'm very pleased to welcome you to the first ever Centennial of an American School of Public Health and Tropical Medicine. I also would like to welcome our friends and colleagues and students from Rwanda who are watching us through the internet today. I'd like to say thank to Ms. Gina Furtado for singing our national anthem, and also to the U.S. Marines. We are really fortunate to have a very large group of alumni, faculty, friends, students here with us today for this very, very special event. It was really nice yesterday to see everybody in town. I had really a very good feeling about it. So thank you very much for all your support. I would like to get started, without further delay, by introducing our first speaker today, somebody who many of you know, Dr. Harrison Spencer. Harrison was Dean at the Tulane School of Public Health and Tropical Medicine, and I think it's because of his leadership that we are here today. He really did a wonderful job when he was Dean. Such a wonderful job then that he was recruited and became recruited by the London School and became the Dean of the London School of Hygiene and Tropical Medicine after being at Tulane. And you will see throughout the day that we have a lot of links with the London School of Hygiene and Tropical Medicine. This is just one of those links. After being in the UK, Harrison came back to the US, and he became the first president and CEO of the Association of Schools of Public Health. So he's now the boss of all the deans, not only in the US, but also around the world. He will deny that, but it's true. Before being a dean, Harrison was at CDC as a parasitologist, and so I know that everybody in tropical medicine here is very happy to have him back. Harrison, thank you for being here, and please come to the podium.
Good morning. Thanks very much, Pierre. You and I both know that I have 50 bosses, one of whom is you. Good morning. Minister of Health Guillaume, Ambassador Ney, honored guests, ladies and gentlemen, many, many friends. It's just such a pleasure to be here and join this wonderful celebration. I was really privileged to be dean of the school. The professional and personal experiences that I had here are ones my family and I really cherish. And the city and people of New Orleans and the leadership, faculty, staff, and students of Tulane School of Public Health and Tropical Medicine University, the medical center, were really ones that's so important and dear to me and my family. In thinking a bit about the Centennial, I enjoyed looking again at John Duffy's book on the Tulane University Medical Center, 150 years. My good friends, the late John Salvaggio's book on New Orleans Charity Hospital, A Story of Physicians, Politics, and Poverty, and the nice introduction that Pierre wrote for the supplement to the American Journal of Epidemiology. And I readily admit I drew heavily on all three of them. So, Centennial invites us to reflect on the past, the present, and the future, obviously. And it's ironic that tropical medicine, the area of medicine that did much to establish Tulane's national reputation, never gained a distinct footing as a separate field of medicine at Tulane or elsewhere. Although the semi-tropical climate of New Orleans resulted in the constant presence of diseases like yellow fever and malaria, there was no separate form of tropical medicine curriculum or professional chair. Rather, the early faculty in the medical school taught these disorders as a matter of course, and they saw little need for formal instruction in tropical diseases. And they really resisted when the Tulane administrators at the turn of the 20th century wanted to formalize the instruction in tropical medicine, recognizing the growing American interest in the Far East and Central and South America, necessitated both an understanding of tropical diseases and specially trained health workers. The terms public health and hygiene had an easier time gaining favor in the academic world as compared with tropical medicine. In fact, Tulane established a formal course in hygiene with a chair at the medical school in 1881. However, things changed with a substantial gift from the United Fruit Company in 1911 for work in tropical medicine. With this funding, the faculty, and all of us in academia frequently change our minds with an infusion of donor funds, but there we go. With this funding, the faculty changed his mind, and they voted to name the chair of hygiene, to become the chair of hygiene, tropical medicine, and preventive medicine. Thus, the hygiene component was the established one at Tulane, and the tropical medicine component added a newer spin. In 1912, Dr. Creighton Wellman, what a great name for a school of public health hygiene. Dr. Creighton Wellman, the head of the Department of Tropical Medicine and Hygiene, published a groundbreaking paper, which is reprinted in the current supplement, entitled New Orleans School of Tropical Medicine and Hygiene. And he advocated for both hygiene and tropical medicine, not just one of tropical medicine. And his vision really included a heavy emphasis on prevention. In October 1912, almost exactly 100 years ago, he was appointed as professor of hygiene and head of the School of Tropical Medicine, followed by his appointment as dean of the school in 1913. While he started off strong, things didn't end so well for the school as far as his tenure went. His life changed course dramatically not long after. In January 1914, he eloped to Brazil with the young daughter of a New Orleans railway owner, leaving Tulane and tropical medicine forever. He changed his name to Cyril K. Scott. They didn't have internet in those days. I wonder if he was worried about people finding him. Anyway, and after stints in odd jobs, eventually developed an excellent reputation as a mining engineer, writer, and painter. He even later became dean of the College of Fine Arts at the University of Denver. This subsequent Renaissance career was of little consolation to Tulane, as the school could not handle his scandalous departure. It fell into disarray and essentially disappeared within the medical school within a year or so, although not formally losing its independence until 1919 with the difficulties of World War I. Only in 1967, under the leadership of Dean Grace Goldsmith, and with the new name of the Tulane School of Public Health and Tropical Medicine, did the school become independent again. Wow, what a beginning. But one clearly in keeping with the colorful history of its environs, New Orleans, Louisiana. Tulane was right there. So, the school closed in 1919 because of the actions of the dean. It almost had closed again in 1974 after having gained its independence in 1967, when its brilliant but controversial dean, Dr. Joseph Beasley, was convicted of fraud for his work with the Family Health Foundation and served time in prison. The school barely survived this blow. So if you think about this historical perspective, my view is that the school will succeed admirably as long as deans don't cause too many problems. It's probably fortuitous that I did not know the history of Deans Wellman and Beasley when I arrived in 1991. However, I can tell you that it was made clear to me during recruitment that the school was in a precarious position as enrollments and research funding had been steadily decreasing. Yet when I had opportunity to meet with outstanding faculty, staff, and students, this really made little sense. There was no reason for the school not to succeed if I did my part and they, the faculty and students and staff, did theirs. Even without a background in the history of Wellman and Beasley, I realized if I did no harm, all would be well. And so we all did our part, and it worked out. Since then, under the leadership of a number of deans, including Paul Welton, Ann Anderson, and Pierre Bukins, the school really has continued to grow and succeed. When I left Tulane, I became dean of the London School of Hygiene and Tropical Medicine, and my colleague Peter Piatt is in the audience, an institution whose history, Peter, does precede but parallels that of the school. People get really into, I was at a table once with a number of deans of schools of public health commenting on whose school began the earliest, so you're really out of the gate well in advance, Peter, except for London, I think. There are many links with Dr. Wellman and many of the earlier faculty with the London School, and both are models of institution that successfully combine tropical medicine and public health. So today, Pierre states in his welcome on the website, Tulane University School of Public Health and Tropical Medicine is committed to advancing public health through learning, research, and practice. Our school is proud of its international respected faculty, its dedicated students, and its resolve to improve health worldwide. Well, I think this is a true statement and an accurate reflection of the school now. It's an institution with history, vision, capacity, and capabilities, and you'll hear more about this in Pierre's State of the School address. Today, the school retains its historic commitment to tropical medicine as it houses the only such department in the United States. As well, it's become a leader in global health. An interdependent world and the forces of globalization have enabled the school to develop formal collaboration in approximately 60 countries. It's also one of the first schools of public health to globalize its curriculum. An example is the creative integration of formerly independent educational departments, such as the establishment of the new Department of Global Health Systems and Development in 2011. And this new department combines faculty, curriculum, and expertise from the former departments of Health Systems Management and International Health. As such, the integrated department and others that have also taken this approach in the school represent fresh new thinking that will prepare students to better meet today's global population health needs. However, as well as global perspective, attention is definitely being paid to the public health issues of New Orleans, Louisiana, and the region. the school has been able to incorporate a global framework to approach and help solve local problems. And this framework is particularly valuable for its students that enter multiple diverse careers. In 2005, a similar event was the first undergraduate class of the Bachelor's in Science and Public Health. It's a brand new educational pathway for college students in Tulane. It started, the pioneering class had 5, I think you have more than 400 now. In initiating this undergraduate program, Tulane joined a burgeoning group of universities early on, offering majors and minors in public health. And the explosive growth of this educational pathway, this undergraduate educational pathway, is really causing us to rethink the continuum of public health education. When Hurricane Katrina devastated New Orleans in August 2005, the majority of the school's hardworking faculty and staff were back at work on November the 1st. After the storm, the first part of the university that returned to their duties. This dedication, along with the students' resilience, loyalty to the school, and with Pierre at the helm really inspiring and guiding the school during this difficult period, highlights the drive of the school to succeed in both good times and in bad. And I actually think, quite frankly, New Orleans and Louisiana may cause academics to have to do that more often. Maybe I'm wrong about that. There you go. When the school opened again in January 2006, the world of academic public health cheered along with you. Like the devastation of Katrina, the tragedy of the Gulf oil spill in 2010 provided another challenge to the people of New Orleans and the Gulf Coast, and the school responded in many ways with research and education programs that help contribute to saving lives in the community and protecting the health of thousands of Gulf workers. And these studies also lent data to ongoing work on mental health among Gulf residents in the local ecosystem. So today, the school has never been stronger as it combines and a framework of global health with a focus on local and regional issues in its research, education, and practice programs. So what does tomorrow hold? Thank you very much. No, I'm sorry. I'll do tomorrow. The school is well poised for tomorrow and a position to lead. I look forward to seeing how other schools take pages from the book of Tulane's model and some other schools that are doing it early on and reshape the future of global academic public health. We need such innovation to tackle the thorny problems that beset us both in this country and globally. There was a recent Lancet Commission on Global Health Profession Education for the 21st Century, which came out in 2010. Julio Frank at Harvard and Lincoln Chin, China Medical Board co-chaired. And as they point out, all is not well with the health of the global population. There are glaring gaps and inequities in health outcomes that persist both within and between countries, underscoring our collective failure to share health advances equitably. At the same time, many and large health and fresh health challenges loom: infectious and chronic diseases, environmental behavior risk, at a time of demographic and epidemiologic transitions occurring rapidly that threaten health for all, and health systems worldwide are struggling to keep up as they become more complex and costly. And professional education has not kept pace with this. According to the Commission, and it's really appropriate for this 100 years to think about the education side of it. You know, 100 years ago, it was curriculum for health professions grounded in science-oriented curriculum. Second phase, much more problem-based approach. And now the third and current phase, in which they feel strongly education needs to become systems-based. Figure out what the system needs, figure out who needs to do it, and then back the education back to be able to provide that. The way it often works now is in universities train people and layer them on the health system. So it's this systems-based. This shift into this third phase, systems-based education, the Tulane School of Public Health and Tropical Medicine has. The recognition by the faculty that global health is not the opposite of domestic health. That's the word, I think Julio Frank is the one I heard first say that. Global health is not the opposite of domestic health, that we live in a global village, and that there's a great need for global population health perspectives throughout the curriculum, and in their research and service activities combine to position the school very well for the future, in my opinion. In addition to its outstanding faculty and its vision, one of the most important and dynamic assets for the school as it looks to the future is its students. Tulane has really always, I think, attracted bright, dedicated, and energetic students. These talented individuals stimulate the faculty, staff, and administrators to become their best selves. They not only dream of a better world, they have a plan to make it happen and then move forward to get the job done. They believe in Tulane. After the devastation of Hurricane Katrina, when the school had to close, ASPH and its member schools placed Tulane students and our members all over the country, and people just really stepped up. And this was tuition free. And it was interesting, one of our major goals, though, was to place them for the semester, and as soon as you opened up, have them come back. And there was some concern that people would get so comfortable. Well, this didn't happen. Virtually every student could not wait to return to New Orleans and Tulane. I remember speaking with groups of them and being so impressed with their passion and their commitment to making a difference and their commitment to Tulane. Tulane is one of a cohort of 50 graduate accredited schools of public health. Randy Wyckoff, an alumnus, is one of the deans. Bernie Goldstein is here, a former dean. There's Terry Fontham is one of our associate members at LSU. There are others that I may miss. And these schools have been growing at the rate of 1 to 2 each year. Together, as members of ASPH, this collective of schools is speaking with one voice on the national and global stage and advocating for population health, for health without borders, and for a stronger focus on health outcomes. And I believe that supports what Tulane is doing locally. Tulane can influence that, and as I say, the collective network, I think, is really powerful as a voice on the national and coincides with another Centennial event, the 100th year anniversary of the historic Welsh Rose Report, published in 1915, which framed the last century of academic public health in this country. We convened a Framing the Future task force that's making recommendations on the future of education for public health in the next 100 years. Pierre, as chair of the Global Health Committee, led an initiative of 150 worldwide participants to produce a competency framework of the abilities expected of master's level students in global health programs. This has informed this process. Secondly, Randy Wyckoff, who's in the audience, led an undergraduate critical elements, am I saying that right, Randy? Critical elements for undergraduates majors, which we've just finished, and this process is going to continue. All of you from our website to participate. We have blogs and all sorts of things. This effort will help inform our accredited schools of public health, including Tulane, as they lead graduate and undergraduate public health education and research in the 21st century. The world of tomorrow needs global population of public health. Benefits society in many ways. Global public health tenets highlight public health as a public good, benefiting all members of society. While local applications must be contextually applied, a domestic focus on population health need not compete for attention with an international one. In a global health system, strengthening one strengthens the other. So for tomorrow, I envision the school continuing your ongoing mission to advance public health knowledge, promote health and well-being, and prevent disease, disability, and premature morbidity and mortality. As today, you will accomplish this dream through academic excellence and a systems approach in education of public health professionals. Rigorous scientific research of public health problems, creative partnerships to advance practice of public health, and innovative service to the local, national, international public health community, all tied together in this very important framework of global health. The only advice I have is to keep on course, strive for innovation, excellence, and flexibility. And of course, watch out for the deans. Laissez les bon temps rouler. Let the celebration continue. Thank you all very much. It's a great pleasure to be here.
Thank you, Harrison. When Paul Walton was here, recruited me 10 years ago, I did my due diligence. I knew about the history, I knew about the hurricanes, and I decided this would be a non-boring job in a non-boring place, and I was not disappointed. I love it. To be global, you need to understand the context. You cannot be focused on diseases, on your lab work only. You need to understand what's going on. And that's why I'm so pleased to have Ambassador Ney with us today, to give us a view of this context in which we work. Ambassador Ney is the former ambassador to Suriname, a country where we have a lot of activities, and we have a lot of friends from Suriname in the room. He is a career member of the Senior Foreign Service and holds the rank of Minister Counselor. Before arriving in Suriname, Ambassador Ney was the Consul General at the U.S. Consulate in Toronto, Canada. He also held postings in Johannesburg, South Africa, New Delhi, India, Taipei, Taiwan, and Calgary, Canada. He is really a fitting speaker to discuss the global perspective. Ambassador Ney?
Good morning, and thank you very much. Madam Minister, and deans, and friends throughout. First, I want to offer my heartiest congratulations to both the School of Public Health and Tropical Medicine and also to all of Tulane University. Tulane School of Public Health has not only got the distinction of being the first such school in the United States, but it also has a distinguished history that brings great credit to Tulane, to New Orleans, to the state of Louisiana, and to the United States. And I also thought it was a bit interesting that the founding of the school in 1912 was in the Centennial year of Louisiana as a state. So I don't know if there was a connection, but we're celebrating not only the centennial of the school, but the bicentennial of the state of Louisiana. You and your predecessors have worked very, very hard, and the world is a better place because of it. Your work, faculty and staff, and that of your alumni has saved tens of thousands of lives directly, maybe millions. We can't count them on every continent in the world. Now, I was asked to speak about the global perspective, and I was told to do so in 15 minutes. So I can't really give a comprehensive history of public health worldwide from the time of the world's first known public health officer to the present. But I will say that first public health officer, when I was trying to figure out who would have been the first public health officer in the world, I found that some people say it was Moses. After all of the health laws that were handed down, and you can read them in Leviticus and Deuteronomy, very clear measures, were far ahead of their time. And they involved food and food handling, washing and waste disposal. Had people always adhered to those public health measures, many of which have been reintroduced more recently and with the help of public health laws and public health officers, many of them from Tulane, certainly history would, not just might, would have been very different worldwide. But so how does one look at public health throughout the world in 15 minutes and the progress over the past century and where we're going? Well, I have to say that I've been personally very fortunate in having had a lot of firsthand experience with public health workers, starting right here in New Orleans. When my friends here at Tulane asked me to speak, they didn't realize how long ago I first encountered public health right here in New Orleans. And in fact, I was born in the Public Health Service Hospital right here, just a little ways away from here. My parents couldn't afford anything better. I was asking my father, how much did it cost? Well, it was free. And they paid a little bit for my mother's meals. But that was one of a whole series of hospitals established across the United States to help sailors. Thus, it was originally the Marine Hospital, later the Public Health Service Hospital, that gave me my start. I've also had the honor of serving in the U.S. Foreign Service for more than 30 years and seeing up close the crucial importance of public health and the advances that have been made in multiple places around the world. First, right here in the United States, where we've eliminated so many of the original childhood diseases, some that many of us, of course, had, and where some of you may remember that we've been having an occasional conversation about healthcare and where that goes. Some of you may remember that, and obviously that conversation is not over. And here in North America, in our neighbor Canada, where the conversation went in a different direction 50 years ago, and where the healthcare system aims to serve everyone, although issues of cost and chronic healthcare issues means that the conversation there also must continue. Taiwan and in Singapore, where major progress has led them to developed status for most of their populations, and where in fact I was medevac to Singapore at one time for surgery, and believe me, it's a first world medical system. South Africa, where healthcare ranged from the very highest standard of care, the sort that led to the world's first heart transplant, to large areas and populations that were lacking in the most basic measures, including reasonable access to clean water. India, where also there's excellent health care available to those who can afford it, where I spent a little time in a hospital in India too. And public health measures are making important advances, but where vast populations also lack the most basic measures. While we were there, my wife and I were privileged to join in some of the vaccination campaigns during the campaign to wipe out polio by going into villages and vaccinating children. And most recently in Suriname, where again much has been done. There's been huge progress, but many challenges remain. Where dedicated people with the Ministry of Health work with other healthcare officials to serve the country's population, both in the capital and in the remoter areas in the interior, in the rainforest. Where issues of access and remoteness play a real role in whether people have access to health care. Where fantastic progress has been made in the fight against malaria, and where there's also a very strong fight going on, a good fight against HIV/AIDS. But where, conversely, a friend of ours also very recently just died unnecessarily of an untreated intestinal blockage. Again, that whole dichotomy that we see that occurs. Across the world, there's been fantastic progress in public health, and Tulane has played a vital role. We can look back with pride on health improvements ranging from improved motor vehicle safety to contraception, clean water, food safety, and the fight against heart disease. There have been outstanding efforts, of course, we all know, against smallpox, polio, so many other diseases, and President Carter has led out in the fight against a number of diseases, tropical diseases in Africa. And of course there have been natural disasters, and Tulane has led out in helping there. The education you've helped provide to students as they have then gone out and helped fight and save people's lives after those disasters has been an outstanding contribution. And of course all of us now are aware of the importance of quickly getting clean water and good food to people right after a disaster to prevent it from spreading. Looking globally, we all certainly have learned in recent decades that health problems do not wind up being contained. They don't stay in one area. Whether one speaks of HIV/AIDS or influenza, SARS, or resurgent tuberculosis, or Ebola, or the rising tide of non-communicable diseases that are related to lifestyle that seem to be spreading back from the more developed countries to middle income and then developing countries. Working globally is the way to go in every sense of the word, and Tulane is working on those, and it's the right thing to do. It's the right thing to do for your students, helping to ensure that they get the education they need to go out and combat these problems. It's the right thing for Tulane, both in terms of carrying out your mission and helping to ensure that you'll be able to carry out that mission far into the future. It's the right thing for the people of Louisiana and the United States who give Tulane so much support. And it's the right thing for the people of the world who also have provided support and students and fields of study and research and who also need your help. And I want to underline that by providing that help, they will be in a position to reciprocate and help Tulane. The benefits to them wind up being benefits to the rest of us. And although it's nearly self-evident, I will add that people who benefit from better public health and from access to health care are in a much better position to take advantage of whatever education is available, to take advantage of job opportunities. They're better equipped to participate in their own government. That's going to contribute to good governance. It's going to make a contribution all around the world, and it starts with public health. Tulane School of Public Health and Tropical Medicine has done a huge amount of good, and I saw it in person in Suriname. And it was truly a pleasure to lead the embassy to cooperate with Tulane's school. The link that Tulane has forged with Suriname over the years is emblematic of what a school of public health can do. It's making a permanent, beneficial change. And there are several notable Surinamers here right now, some of whom are Tulane alumni, and some of whom will be Tulane alumni. I can't help but noting that Suriname's Director of Health is here with us today. Another prominent physician, her husband, is also an alumni of Tulane. He's here. Who are here working on PhDs and will go back to make contributions to Suriname. That thanks to one of your faculty members, Dr. Maureen Lichtfeldt, and the Dean, there's an ongoing and expanding program to train further public health officers in Suriname. There's research going on to help prevent suicide. There's a Fulbright scholar in Suriname this year from Tulane, the first Fulbright scholar we've had in Suriname in years, and he's working in a health-related field. There's important research going on, led by Tulane, on the levels of mercury in fish and the effects on health there for those who depend on those fish for food. Tulane is doing all of that, and it will make a permanent difference. With all that in mind and with all the progress that's taken place, you have a lot for which to be grateful. But unfortunately, I think I better suggest that a lot of the easy part is behind us. The list of the greatest 10 public health advances in the United States over the past century, wonderful. Clean water has by itself saved the lives of millions. But the challenges ahead are just as big, and they're more complicated. Many countries and billions of people still face the same basic challenges that you have already tackled and largely resolved in the developed world. Those people cannot be forgotten. New diseases arise, or they spread to new areas, and they have to be tackled in new ways. HIV/AIDS is the best known, of course, but there's a litany of others. SARS, West Nile virus that spread, and so on. And those new diseases alter old diseases. And for example, after having beaten, we thought, tuberculosis, it's now coming back, and drug resistant. Apparently largely due to HIV/AIDS, but we're seeing the spread of other drug resistant infections, partly of course due to the overuse of antibiotics, including in livestock. Tropical diseases may also spread to new areas if climate change also winds up providing new and hospitable areas for those diseases. And just as we're getting a handle on the basics of providing clean water and refrigeration and vaccination, and while some populations are not even fully on that path, we're seeing many of those same societies follow our society down the road of the non-communicable diseases that are largely lifestyle diseases, obesity, diabetes, and so on. The bottom line is that the coming century is going to demand even more and better work. Let me just add that I am confident that the Tulane School of Public Health and Tropical Medicine is going to be in the forefront of doing just that. You have great people, you have great students, you're in a position to recognize the problems, and you're helping to train a new generation of professionals from all over the world, including from a broad array of cultures, ethnic groups, and religions. I know because they were all present right there in Suriname, and the work you're doing there is doing exactly the kind of work that needs to be done. You're doubly fortunate. You will have a real career, and I'm speaking to the students, a real career, but it's also a mission. You're not just in it for the money. You'll be contributing to your own society and the world. And when things are tough, you will remember that you are not just in this to serve yourself and become rich. You are serving all of those all around you. Let me close by reminding you of one of the broadest and most telling sayings in any religion, but applicable to all religions, about helping others. That is the text in Matthew, when Jesus urges his followers to feed the hungry, give drink to the thirsty, to help the sick, and to visit those in prison. For, as the text goes, inasmuch as you do this for one of the least of these, you are doing it for me. Other religions also commission their followers to serve others: Islam, Judaism, Buddhism, Hinduism. But that, my friends, is a mission. When you go out there and help people to lead healthier and better lives, you are carrying out a mission. And if you believe in God, you are also doing it for God's children and for Him. And if you don't, you are still doing it for all of humanity in a way that deserves our gratitude. So thank you so much for all you've done, and may you be successful in all your endeavors as you rise to meet the challenges of the century ahead. They'll be big, but I know you'll do great work on them. Thank you.
Thank you, Ambassador Ney. It is now my distinct pleasure to introduce our keynote speaker this morning, who is a very special guest from Haiti. Her Excellency Florence Duperval-Guillaume is the Minister of Health and Population of Haiti. She is a pediatrician with 25 years of medical and public health experience. She worked first as a clinician and then got graduate training in public health at the University of Michigan, Hopkins, and Harvard. She has been working with USAID funded projects for many years, working closely with the North American NGO Management Sciences for Health. And she has been extremely successful in doing that. This experience she had in health governance and leadership in the health sector has been really recognized internationally. She has been called to testify before the US Congress after the earthquake in Haiti. She is really very well known, not only for deep, profound public health experience, but also for integrity, credibility, and a recent appointment as minister has been really a sign of hope for everybody in the public health community and around the world. C'est vraiment, Madame la Ministre, un honneur pour nous que vous ayez pu vous joindre à nous pour ce centenaire. Vous allez parler à la fois en français et en anglais, ce qui reflète aussi l'expérience de la Louisiane. Madame la Ministre.
Thank you. Bonjour, good morning, buenos dias. I don't remember the last one that you said. Provost Michael Bernstein, Associate Provost Dr. Tanet Kosselborn, Dean Dr. Pierre Buckens, Associate Dean Dr. Luan White, Associate Dean Dr. Gita Benson, Ambassador Lee, Professor Pierre, distinguished guests, my friend Haitian that are with me today. It is a great honor for me to be here and to extend to you congratulations from the Haitian government on the centennial anniversary of Tulane School of Public Health and Tropical Medicine. This anniversary, which represents 100 years of services, not only to the United States of America, but also to many countries, such as Haiti, that are involved in regional partnerships. Today is more, much more than a celebration. It is an opportunity to strengthen our commitment and our determination to prepare more generations of public health leaders who can make the world a better place to live. As in other developing countries, Haiti today has committed to a clear goal of entering the ranks of emerging countries by 2030. To achieve this goal, our President, Michel Joseph Martelly, and the Prime Minister, Laurent Salvador Lamotte, have made a strong commitment to universal health and education in Haiti. In addition to vision, this will require strong leadership and local and international partnerships. Haiti is living its 208th year of independence, and it is clear to us that the strategies used previously did not yield the expected results. Today, we should recognize that only well-educated and healthy men and women can produce strong institutions, sustainable organizations, and the social and economic resources to join the developed family of nations. That is why, as never before, we believe in education. We believe in educated men and women who are committed to the fight against poverty and move toward development. The possibility of solutions and to bring about change in our world, including in Haiti, is what led to the founding of this school and is what also justifies my presence here. We can transform conditions to changing the paradigm of expectations by having a united voice and promoting consistent actions for global change. We are not yet at the end of the road. We only have some difficulties navigating certain curves. To continue and assure our success, we need to not only have a vision of the end of the road, but to fill ourselves with empathy and modesty, sharing with the poor and vulnerable, understanding what they feel, what they need, and where they live. We need to listen and plan with them. We need to create a bridge between relief and rebuilding by using relief actions as a platform, a foundation on which we are building sustainable development. We must always remember that through education and health, we are rebuilding people and nations. I strongly believe that giving hope to people by acting with them will bring all of us back the hope to continue and make a difference in people's lives, but also in ours. This is what global health stands for. This is what global health means. For what the Tulane University School of Public Health and Tropical Medicine has done in the past, and what its graduates in country and out of state will continue to do in the future. I congratulate all of you. Let's continue to be the light and to achieve illumination. Tulane University shall still hold high the torch. May God continue to bless all of you. May God continue to protect all of your families. May God continue to protect and bless the United States of America and my country, Haiti. Thank you.
Thank you so much, Madam Minister. Your presence here with us today means really a lot to the entire Tulane community. We will now have a short break before going on with the rest of the program. We'll have two